Okay, good day, everyone. We are going to continue our discussion on diabetes mellitus. And first off, we are going to focus on the criteria for diagnosis of diabetes mellitus. Now, we begin by looking at the criteria for diagnosis of impaired glucose tolerance. Remember earlier we said that impaired glucose tolerance is when glucose level in an individual is not high enough to be classified as diabetic, but also higher than the higher limit of a normal glucose level. So that means in between the higher limit of a normal glucose level and the lower limit of glucose of high glucose, that is diabetes mellitus. Any individual who falls in between this range can be said to be having impaired glucose tolerance, or you could literally say that the person is pre-diabetic. And remember that we said that if pre-diabetes is not managed effectively, the person, many people can swing into full-blown diabetes mellitus. So and a lot of people are going around. I'm sure up to 60% of individuals are pre-diabetic and we don't even know about it. So that's why medical screening from time to time, at least once a year for people who are less than 40, and then those who are above 40 once in 6 months, it's important to continue to check blood glucose level. Now, having said that, we look at the criteria for diagnosis of impaired glucose tolerance, and the first one is a fasting blood glucose of between 6.1 millimoles per liter to 7.0 millimoles per liter. So once the fasting blood glucose of an individual is higher than 6.0 millimoles per liter up to 7.0 millimoles per liter, or any value that falls in between 110 and 126 milligram per dl, you could say that this individual is having impaired glucose tolerance. Now, apart from a fasting blood glucose, oral glucose tolerance tests can also be used in diagnosis of prediabetes or impaired glucose tolerance. And so, an oral glucose tolerance test of glucose level at 2 hours after glucose consumption, that is between 6.1 to 7.8. If it is falling between 6.1 to 7.8, you could say this person is having impaired glucose tolerance and it can be declared as a pre-diabetic individual. But once an OGTT is higher than 7.8, it's no longer impaired glucose tolerance or pre-diabetes. So the emphasis is that the value for diagnosis of pre-diabetes is between 6.1 to 7.0 millimoles per liter, or between 110 to 126 millimoles per liter. Also, that is for fasting blood glucose. And then for OGTT, 2 hours glucose level after consumption of less than 7.8, that means between 6.1 to 7.8, is diagnostic of impaired glucose tolerance or pre-diabetes. So now we look at the criteria for diabetes mellitus, diagnosis of diabetes mellitus proper. Now, the first one is the fasting blood glucose. The fasting blood glucose level of greater than 7.0 millimoles per liter, or greater than 126, greater than or equal to 126 milligram per dl, is diagnostic of diabetes mellitus. So if an individual presents and is having the fasting blood glucose of that individual that has fasted for between 8 to 12 hours is falling anywhere on 7.0 or greater, or 126 milligram per dl or greater, 7.0 millimoles per liter or higher, or 126 milligram per dl or higher, is diagnostic of diabetes mellitus. Also, if an individual has come fasting and is administered glucose of maybe an average of 75 milligram of glucose for, and then after consuming glucose and after 2 hours of glucose consumption, you measure glucose level. If that glucose level is higher than 11.1 millimoles per liter, if it's higher than 11.1 millimoles per liter, you could say that that's diagnostic um, is diagnostic of glucose of diabetes mellitus. That is diagnostic of diabetes mellitus. So you could not just come out and say somebody is diabetic without a proper diagnosis. Without a proper diagnosis. So now, 11.1 millimoles per liter or greater than 200 milligram per DL is diagnostic of diabetes mellitus. Now, we have looked at fasting blood glucose criteria. We have looked at 2 hours glucose administration, 2 hours post glucose administration. We have said it is 200 milligram per day or 11.1 millimoles per liter. Then another tool that can be used also is the glycated hemoglobin. Now, glycated hemoglobin is a parameter that can be used for the diagnosis of diabetes mellitus. In subsequent lecture, we'll talk fully on glycated hemoglobin. But first, a glycated hemoglobin value that is greater than 6.5%. The glycated hemoglobin level that is greater than 6.5% is diagnostic of diabetes mellitus. Now remember that the glycated hemoglobin value of less than 5.7 is diagnostic, or is of less than 5.7 indicates a normal blood glucose for an individual that is non-diabetic. But for somebody who has impaired glucose tolerance, if you measure glycated hemoglobin in that individual, glycated hemoglobin will be between 5.7 and 6.4. Any glycated hemoglobin of any individual that is falling between 5.7 and 6.4, that indicates impaired glucose tolerance or prediabetes. But however, for diabetic individual, glucose level of greater than or equal to 6.5% is diagnostic. Then another tool that can be used, even though it's not advised to rely on it singly for the diagnosis of diabetes mellitus, but it can, with that, one can have an idea that okay, this person is likely to be diabetic, which can be confirmed using either glycated hemoglobin or fasting blood glucose or even oral glucose tolerance test. Now, in random blood glucose, if an individual appears at any time and you measure blood glucose and is having blood glucose of greater than 11.1 millimoles per liter, that is like 200 milligram per DL, in combination with certain signs and symptoms of diabetes mellitus, it's a pointer that this person is diabetic. However, it's not 100% used in diagnostics. It's just a supportive diagnostic tool. Now, another one is the oral glucose tolerance test. Now, the oral glucose tolerance test is used in diagnosis of can be used in diagnosis of diabetes mellitus. Now in OGTT, you call the patient come fasting between 8 to 12 hours of fast in the morning, and then the fasting sample is collected. The individual is administered about 75 gram of glucose, and then once the individual takes that glucose, after exactly 30 minutes after drinking of that glucose, they collect the effect sample. After 1 hour, another sample is collected. After 1 hour, 30 minutes, another sample is collected. And after 2 hours, another sample is collected. Now, at each of them, 30 minutes, 1 hour, 1 hour, 30 minutes, 2 hours, the expected value of glucose that are supposed. Now, the highest value of glucose that should be gotten in that individual should be at 1 hour. And it's expected that after 1 hour, the glucose level begins to come down. So at 2 hours, it would have come down up to maybe 11.1 millimoles per liter of glucose. Now, that is diagnostic of diabetes mellitus. So that's the diagnostic criteria for diabetes mellitus.